Partnership Power Hour with your host, Sandra Shelson, featuring guests Belinda Lane and Dr. Tariq Shafi.
Everyone, welcome to our May 10th Power Hour call. We were just talking about the fact that, it's been over 2 years and we're still going strong, and we really appreciate everyone who finds value in this and participates and offers to be a speaker. It's just incredibly important, I think, to all of us. And I'm Sandra Shelson. I have the pleasure of being the Executive Director of the Partnership for a Healthy Mississippi and the facilitator of the Power Hour call. We are very fortunate today that our program is with our program today. And we also have joining us Sharon Nettles, who is with the Yazoo County Extension Service, and she will give us an extension minute towards the end of our call today. Just as I always do, I would like to once again welcome you and, hope everyone is happy and healthy. We are turning that corner in Mississippi, as we often do about this time of year, where the temperatures soar, and you go right from a couple of beautiful spring days into incredibly hot 90-degree weather. So everyone be cognizant of that, stay hydrated, and we'll muddle through this one more summer, as we always do here in Mississippi. So I'm going to go ahead and introduce our speakers today. Our program is about organ donation, and a little bit different take on it with our third speaker today. But our first speakers today are from the Mississippi Organ Recovery Agency, otherwise known as MORA, and we have Belinda Lane, who is the Community Outreach Coordinator, and also joining her today is Chuck Stinson, and he is on the staff of MORA. And then our second group that will be talking to us is Dr. Shafi, and he is with the University of Mississippi Medical Center, and he will be talking to us about kidney donation and a particular program called the STEPS program that Mississippi is fortunate enough to be a part of. I would like to remind everyone that these our Power Hour calls are now being recorded, and they will be available. You can access them through our website, healthy-miss.org, or you can join them by Spotify. I think that they have been available through Facebook, but that is going to go away. So just know Spotify, go to our website. The materials and the biographies of our speakers are also available on our website. Now, without further ado, I'm going to turn the program over to Belinda Lane with MORA. And remember, Belinda, you need to star 6 yourself and make sure that your phone is unmuted. Belinda?
Thank you, Sharon. Thank you, Sandra. I'm sorry. Can you hear me?
Absolutely.
Great. Good morning, everybody. So I'd like to share with you that I am with MORA. I serve as the Community Outreach Coordinator, along with Chuck Stinson, who is our Director of Community Outreach. And we are so happy to be a part of this call. We're just elated and delighted because we enjoy sharing how important it is to become an organ, eye, and tissue donor. I know that so oftentimes people about organ transplant as just that, just the organs, but we like to include how important it is to also be aware that not only are we talking about registering to be a donor for organ donation, but also eye and tissue. But I want to give you a few facts about MORA. We are one of the 58 OPOs in the United States. And when I say OPOs, I'm referring to organ procurement organizations. And we are strategically located on Lakeland Drive, right next door to Mississippi Sports Medicine and Enterprise Rental Car. And we're strategically located there because we have easy access to the hospitals and to the airport, just in case you didn't know. But I want to share that currently over 100,000 men, women, and children are waiting for a life-saving organ transplant, which means that essentially every 9 minutes, a new name is added to the waiting list. On average, that means about 17 people die each day while they are on the waiting list, and more than 1,300 Mississippians are currently on our waiting list. Although we have over 1 million on the Mississippi registry, we always encourage people to please register to become an organ donor. So I also want to make mention of the little red heart on the license. I'm sure that some of you have gone to your local Department of Public Safety offices. And when you get there, they normally ask the question, do you want to be an organ donor? And we certainly hope that you say yes each time that they ask. But I want to share that when you see that little red heart on your license, a lot of times there's a myth about that little red heart. That little red heart on your license means that you wish that your organs to go on to or passed on to save someone else's life after you've passed away. Having that little red heart on your license does not compromise your medical care in any way. A lot of times there's a myth. That's a huge myth that people will say, if I have the little red heart on my license and something happens to me, that the medical professionals won't try and save me. That is the farthest thing from the truth. We do not want people to take a part on that myth, and we want to educate you and let you know that is so not true. Medical professionals are going to do everything within their power to save you. Now, we also want to share that anyone that's age 15 can sign up to be an organ, eye, and tissue donor in Mississippi. However, until 18 years of age, a parent or legal guardian will still have to give consent. But as your students go to get their driver's permit, we encourage you to allow them to become an organ donor. And please know that anyone can be a donor, regardless of their age, regardless of their health, regardless of their race or ethnicity. We just encourage everybody to register to be an organ donor. Now, while 90% of U.S. adults support organ donation, only 60% are actually signed up. People become so busy, they say, okay, when I go to the DMV, that I'm going to make sure that I sign up this time. They get there, and then for some odd reason, they change their minds or they're in a hurry, and they decide, oh, I'll do it next time. 4 years or even 8 years in some cases will pass by, and people still will not have signed up to be a registered donor. So we'd like to share that while 90% of folks support organ donation, only 60% are actually signed up. We need to increase those numbers. The reason that we need to increase those numbers is because only 3 in 1,000 people will pass away in a way that actually allows for organ donation. And just in case you're wondering, let me just share the reason that organ donation is so rare. First, a donor has to pass away in a hospital. 2, a donor has to be placed on a ventilator prior to death. And this is so that blood and oxygen will continue to flow through those vital organs. And the third thing is that a donor has to have an injury that has resulted in brain death. And so those are the 3 things that make organ donation so rare. Whereas we may sign up, there's still a possibility that you still may not be available to be a donor. So we encourage everybody, absolutely everybody, to register to be a donor. And the other part of that is 1 donor can save up to 8 lives. Just think about it. 1 donor can save up to 8 lives. And those things that they can donate include a heart, lungs, liver, pancreas, 2 kidneys, intestines. One tissue donor can enhance over 75 lives. So just think about the fact that you can save up to 8 lives with your donation. I just recently met a guy who was a very young guy, received a pancreas and 2 kidneys from a donor. He received this gift of life on Christmas Day of last year. And so he's thriving and doing extremely well. And we love to hear these really great stories. So if you have other stories that you'd like to share, feel free to contact us. We're always looking for great stories about people who are doing well, who are thriving as a result of organ, eye, and tissue donation. And as you very well may have guessed, the thing that people are waiting for the most, or the organ, should I say, that people are waiting for the most, of course, is the kidneys. Kidneys are at the top of the list. And then there's the liver, heart, lungs, pancreas, intestines, and so many other things. So there are 2 kinds of donors. There's the living donor, and then there's the deceased donor. Of course, the living donor, they tend to make that personal decision during their lifetime. They can donate 1 kidney, they can donate a lung, or they can donate a portion of their liver, their pancreas, or intestines. And I like to share that I actually worked with someone who donated her kidneys to her dad. So we always hear about stories like that. I recently, last week, met a family. The 14-year-old was in need of a liver. So his father was able to donate a portion of his liver to him. They were a perfect match, and he is doing extremely well. This took place about 2 years ago, from what I understand. And so we love to hear stories about people who are doing well and thriving, again, as a result of kidney donations or any kind of organ donation, because we hear them all the time, and we have lots of really feel-good stories about it. And I'm going to see, is Chuck Spencer on the line?
Yes, I'm here.
Hey, Chuck. Okay.
Hey.
So I'm going to pass it over to Chuck so that he can also share. He's been at this a lot longer than I have, and he's always doing a great job and always spreading the word. So I'm going to pass and share a bit so that he can share some of this information as well.
Well, Belinda, you didn't really leave me a lot to share. You covered pretty much all the as you went through that. That was incredible. That kind of covered everything that we do in a nutshell. We have been a facility since 1992. When we were independent from University of Mississippi Hospital, from UMC, and our CEO has been Kevin Stump for all of those years, and we have grown from a staff of 5 in the first year or so to over a staff of 70, and that's because of people's willingness and understanding that that organ donation is important. It's important to Mississippians. It's important across the country. And we were very, very pleased to cross over 1 million people being registered in Mississippi. And that's still low by national standards in terms of percentages. And we work hard daily to get people to register and to think about organ donation, at the very least to have a conversation about it, which is really the most important part of anything. Yes, registration is important. And when you do register, it is first-person consent. So you need to have that conversation with your family that you have registered and they are understanding of your wishes, because donation can and will take place if you are a registered donor, because it's like a last living will and testament. So the conversation is equally as important, if not the most important link to donation, because your family needs to know your wishes. You need to make your wishes known, And we want that too. We want people to be at peace with their decision. We want people to register because they know that the opportunity is there to carry on in life. There's an incredible testimonial story from a family a few years back of their son who had suffered kind of a brain swell. He was on a football field. Walker Wilbanks is his name, and his mother and father, David and Sheila Wilbanks, had no idea that he had registered as a donor. Well, in fact, he had gone in and thrown his license down on the kitchen counter and was talking to his mom, and he said, "Mom, I'm registered as an organ donor. Are you?" And she goes, "No." And because of that conversation, Sheila recalled that conversation when they were approached about the potential for donation because Walker had progressed to brain death. And because of that conversation, 5 lives were saved, including a mother who had coded multiple times in Mobile, Alabama. And now she is thriving. She has adopted children. One of those adopted children is a redhead, just like Walker, and David and Sheila are the godparents of that child, and he has red hair, just like Walker. And it's just an incredible story, an incredible community to be a part of too. You'll never get over the loss of losing a loved one in this process, and nobody expects anybody to, or to think that this is some sort of grand decision that's going to help you process this even easier. It's not. It never gets any easier when you lose a loved one. And but it does maybe help make some sense of some things that your loved one can carry on. I've been privileged to be a part of families listening to the hearts of their loved ones placed in someone else's chest, and it's incredibly moving. It's incredibly just so emotional for everyone involved. It's incredible what these families do in these times of tragedy, and they make the decision. If the loved one hasn't made the decision to be a donor, and the family still decide that they want to make their loved one a donor, that they want to honor their loved one by them being a donor, it's incredible. It's incredible to do that in moments of these. This is the most dire situation that you will probably find yourself in, because it's always some sort of brain accident. Brain where they have suffered some sort of injury, a head injury in a car crash, or on a fall, or a bleed, or something like that. And it's so very, very unexpected. And that's so incredible for people to make that decision when their loved one is going through something like that. And like Belinda reiterated, there's not a lot of opportunity for organ donation. 3 in 1,000 people are ever qualified medically to be an organ donor. That's why we ask people to get registered and let the medical evaluation take place at the time of death. There's even certain cancers that you can still be an organ donor with ocular donation or some other opportunities, just depending on where cancer has spread and how it's affected things. Tissue donation is very, very important, and we want people to understand that you can help up to 75 others with tissue donation. In fact, there was many years ago when I first started in the business. I've been at Moore for 13 years. A couple of years in, one of our tissue director called me in and showed me that there was one tissue donor that they had grafts from that had been utilized in 149 cases. So 149 people, and this could be as small as a little bone fragment that was used in a surgical replacement or something to hold something in place. So the potential is great to help others with tissue donation, and certainly with ocular donation as well.
And just to add to what Chuck has already stated, we'd like to add that we also have scholarship opportunities. We invite folks to go to our website, which is msora.org. There are scholarship opportunities there, and there are several. And what I always say is $5,000 is $5,000, $500 is $500 when you are going to college, and those scholarships can be very, very helpful. We also like for you to know that we are on social media at Donate Life Mississippi, on Facebook, Donate Life MS, on Insta, at Donate Life MS, on Twitter, Donate Life MS, on YouTube. And to also let you know that we are always out in the community. We provide or we attend health fairs. We're always doing classroom presentations. If we have any teachers or educators on the line or anybody that's involved in the community and you'd like for us to come out and present, we are more than happy to be able to do that for you. If it aligns with our calendars and our timelines, we will come to your area and share our presentations with you.
Can y'all hear me?
Yes.
Yes.
Yeah, okay.
Yes.
I had a couple of questions before we moved on. One of them, you were talking about, and it was very informative to me because I had no idea how rare, even if you're willing, how rare it is that you would be able to actually donate.
Be a donor.
That's crazy. But let's talk a little bit more about lifetime donations. I had an aunt who donated a kidney to my uncle, but that was in a familiar situation, family situation. How do you go about doing something like that, like bone marrow? You hear a lot about the need for that. You've got someone who's got leukemia or something, and they're kind of sending out a notice. Let's do a little bit more of those where there's not a family member perhaps that's available, but tell us a little bit more about that.
Well, I can talk about that a little bit personally, actually, with bone marrow. Now, that is not what we do. We do whole organ transplants and tissues, but I'm a stem cell transplant recipient as of July 22nd. I had a very rare disease called HLH that attacked my body in September of 2020, and I received a bone marrow donation, which goes through Be the Match, and that is people that can supply bone marrow to other people. Now, typically you want somebody that's close to you. I did not have a match close to me, but I had a 10 for 10 match in a 27-year-old female from the United States who I have not met yet. We've corresponded, but that's how they go through that. And sometimes those, when it's a matched unrelated donor, a mud donor as they call them, it's going to take a little longer to recover than it would be from a familia donor within the family. So, and sometimes, they, like my children were a 5 for 5 match, and this young lady was a 10 for 10 match. So we went with the odds on that one. As for whole organ donation, what happens is that we just recover organs. We procure the organs for transplant, but we don't have any say into where the organs go. We punch in numbers and tissue type and blood type and size that are very important in terms of when you're especially talking about lungs and hearts. They have to match the body cavity, and they have to match the you wouldn't put my big heart in a little person, or you wouldn't put a little person's heart in mine because they wouldn't be able to sustain me. So there's blood and tissue typing, and there's a mathematical formula that they go through. Sometimes it's how long you've been on the waiting list. Sometimes it's how sick you are. Sometimes you can jump up to the top of the list because of how sick you are. Sometimes, you may fall down because somebody else jumped you on the list. but that because of the illness. But a lot of it is blood and tissue typing and medical necessity. And that is operated through United Network for Organ Sharing, and they will help. We'll put the blood and tissue type, the type of organ, and put it into the computer for United Network for Organ Sharing, and then the transplant centers will start reaching out to you, and then there's a protocol and a way they go about deciding where the organ will be sent to and transplanted, or who will come to recover it. A lot of times heart and lung surgeons will come here to recover. A lot of times they'll let local surgeons do it. It just depends on the transplant center and their doctor's needs. So there is a system in place, and they are trying to revamp that and trying to make it more equitable across the country. And that's one of the things that we are certainly in favor of. We want everybody on the transplant list to get transplanted. And we work to do that every day. We want every Mississippian off of that list if that's possible. Unfortunately, and not enough people donate at this point, and mechanical organs are not necessarily ready for transplant. 3D organs they're working with, and they're working with different types of organs and trying to, seeing what they can do. I think there was a pig that had an organ transplanted into a human not long ago. It didn't last long, but they're working. Those are genetically altered pigs, and we're working hard to get those things done. But as of right now, the only real viable option is human organs for transplant.
Okay. So another question I have is, so I have my driver's license. We talked about that. And is that the best way, or if you you're committed to being an organ donor, and I've done it through my driver's license, and I know you said talk to your family about it, but are there any other steps that would need to be taken so people would know that, to help ensure the best possible scenario for being able to be an organ donor?
It goes all into one database, and one registration is all you need. So if you're registered on your driver's license, or you register on our website, or you register at a health fair when you see one of our staff members there, whatever, it all goes to the same place. And you can also manage your registration, too, at registerme.org. If you've got all your pertinent information, your driver's license number or your Social Security number, you can manage your own registration. You can make any kind of alterations to the registration that you'd like. Like if you don't want to donate your eyes or your cornea, or you don't want to donate tissue, you can do that. We ask that you not do that, because there are opportunities there for people that can see again, or there are opportunities for people who can walk again. But you can maneuver and work around that registration at registerme.org. And if you're registered on your license, you will be in that database.
And Belinda, you had provided some highlights, some of the things that I think frequently asked questions, like does donation impact funeral plans? Is there a cost to the donor? Yeah, so I just was hoping you would cover a couple of these, because I think these are some important questions that people have.
Yeah, so thank you, Sandra, for asking that question. But as Chuck just alluded to, you can always change your donor status at any time. But the thing about donation is that the families are not charged for donation. Donation does not impact funerals at all. As soon as the transplantation has taken place, that hero has been moved on, or will be moved on, to the family's funeral home of choice. So donation certainly does not impact the funeral at all.
Are there
the other
any
myths that I'd like to...
Oh, go ahead.
I was just going to say that one of the other myths that sometimes people get a little bit caught up in, again, is the fact that when you see the little red heart on your license, that means that the the professionals, the medical professionals are not going to try to save you. And that's one of the hardest myths that we have in terms of trying to debunk. We want folks to know that medical professionals take an oath and they're going to do everything within their power to make sure that you're saved.
We talked about the fact. Yeah, I was going to ask you. A lot of times I see where people have donated their bodies to science, which is all inclusive. Does that follow the same protocol as organ donation, or is it different?
I'm going to let Chuck answer that one.
Yeah, it is a little bit different. Currently at the University of Mississippi Medical Center, they do not take whole body donation from an organ donor. There's a group out of Memphis that can handle that, and I'm certainly drawing a blank on their name right now, but they will take whole body donation after organ donation. But it is a different protocol. You have to register early that you want to do that, give your body to science, and certainly we support that too for people that can't be organ donors. And even if they could be organ donors, I mean, it's still a help for the scientific community that we have people that donate their bodies to science. But it is a little different protocol. You just have to get registered in advance with the facility that's nearest to you.
Okay. And we'll take questions from the callers at the end of our hour. But our next speaker is Dr. Shafi, and he's going to kind of move this conversation in a little bit different direction, but it's mostly focused on kidney donation. So Dr. Shafi?
All right. Can you hear myself?
Yes.
Can you hear me? Okay.
Loud and clear.
Loud and clear. All right. Thank you, Ms. Shelton. So my name is Dr. Tariq Shafi. I am the chief of the Division of Kidney Diseases at the University of Mississippi Medical Center, and I am a registered organ donor. So, and I think in relation to the conversations we just had, I can't really think of any reason why somebody would not be an organ donor. All my family members are as well. So what I would like to talk about specifically is kidney disease, especially advanced kidney disease, kidney failure, and why we really call kidney donation and kidney transplantation a gift of life. So just to put some perspective on things, kidney disease is common in the United States, and the risk factors for it. The three big risk factors are diabetes, hypertension, and obesity, and all these three diseases are quite common in Mississippi as well. And as a result, in Mississippi, is probably one of the highest. It is one of the highest in terms of the number of patients per million population with kidney disease and with end-stage kidney disease. So generally, there's about so the challenge that we have is that generally there's about 30 million people with kidney disease in the United States. So 1 in 7 adults has kidney disease. However, when you start to look at specific numbers, about 1 in 40 adults in the United States are at risk of severe and progressive kidney disease, but it's really 1 in 200 adults in the United States that are at risk of progressive kidney disease and kidney failure in the next 2 to 5 years or so. So even though there's a lot of people with kidney disease, it becomes a little bit of a challenge in terms of identifying who is at the highest risk of kidney failure. And then I'll sort of talk about what this program that we have is doing in a second. But one of the problems that happens is that when your kidneys fail, the only way to sustain life is through dialysis. And sometimes people think that, well, doing dialysis is like replacing my kidneys, just like replacing tires on my car. I will be just fine doing dialysis. And it's actually not really like that. Obviously people have to go through the dialysis treatments several days a week. That has its own sort of, complications related to it. But 1 in 4 people that actually start dialysis do not survive the first year on dialysis. 1 out of 2 will die within the first 3 years, and 2/3 of the people don't survive to 5 years. So yes, it actually can sustain life for a short period of time, but it is nowhere as good as a kidney. And that's really why organ donation is really a gift of life, because you're really sustaining somebody's life and improving their quality of life, and making sure that they remain, around for their loved ones. So just in terms of some numbers in Mississippi, there's about 1,500 to 2,000 people that actually start dialysis every year in Mississippi. We have about 8,000 people that are on maintenance dialysis. And it's only a small fraction of those people, I believe around 1,500, are on the waiting list. And we don't have enough organs for everybody. And sometimes people have to wait for a long period of time to actually get an organ. So in terms of treatment of kidney failure, advanced kidney failure that really requires some type of kidney replacement treatment, the best treatment is a kidney. And the best type of kidney is actually the one that comes from a living donor. And if that's not available, then the kidneys from a deceased donor that we were just talking about. So I think the challenges we've had are, so one of the challenges is that how do we as providers and doctors and nurses in a healthcare system identify the patients that are at the highest risk of getting to this kidney failure stage and prevent them from sort of, crashing into dialysis is one thing. And then how do we actually move them towards getting evaluated for kidney transplantation, and specifically living donor kidney transplantation, even before they've reached the stage of kidney failure that requires dialysis. So that's where the STEPS program comes in, and it is doing two things. So it's addressing issues at this health system level, where we want to come up with systems for identifying people that we have in our healthcare system that have been going through the clinics, but have really sort of not moved along this process of evaluation for kidney donation. And the other part that we're doing is we want to reduce the disparities that exist in both deceased donor kidney transplantation, but also living donor kidney transplant as well. And there, the disparity is actually really huge in terms of the people that get the living donor transplant. So the two parts of the STEPS program, and the STEPS stands for system interventions to achieve equitable and early transplants, or STEPS study, are a system level intervention where we actually have these algorithms that we have sort of developed to identify people with advanced kidney failure, and then a social work and a transplant coordinator intervention where the social worker actually reaches out to the patients at an earlier stage of kidney disease when the kidney function is about 30% and nowhere close to dialysis, and sort of helps them, educates them on kidney disease, treatments of kidney disease and kidney donation and transplantation as an option, and then how to approach this question of living donation with family members, members in the community, in the church, and in other places as well. And this sort of comes out of research that has been done over the past, I would say, 20 years or so, funded by NIH as well as PCORI, where they've sort of designed these methods of providing this education to people in a structured manner that is equitable and understandable by the patients as well. I think one of the unique features of this program, and it's also a research study as well, is that typically when research is done, the researchers, for example, somebody like myself, would come up with a research protocol, talk to a few colleagues, and we then sort of go through this evaluation process by NIH, gets funded, and then we carry out the research. But this type of research in the STEPS is what we call a patient-centered outcome research. And in this research, we actually involve the stakeholders that include community members such as Ms. Shelton, as well as patients with kidney disease, patients with kidney failure, patients on transplant as well. And their input into this whole process is actually really critical in how we actually design the intervention and improve and try to improve the outcomes. So that's sort of a nutshell of kidney disease and the STEP study. And we have the study that is actually ongoing right now. In terms of who's eligible for the study, it's so right now it's people that have been seen within the University of Mississippi Medical Center system that have kidney function that is below 30%, or we use the term called eGFR, which is how well your kidneys are working. And if that number is less than 30, people are eligible. Or if by a combination of this eGFR number and how much protein people are leaking in the urine, we can identify if somebody is at high risk or more than 10% risk of kidney failure in the next 2 years or so, and those people are eligible as well.
Okay, that's great. And yes, Dr. Sheffy, I am excited to be a part of the community outreach, board. I guess that's what it's called, advisory group. That's it, advisory group. So it is that, as I mentioned earlier, having had a family member that kidney disease impacted, it really does make a difference. Okay, so at this point, we will ask everyone if you have a question to *6 yourself and ask any of our 3 speakers today. Are there any questions? Okay, hearing none. Remember, everyone, that all of this information will be available on our website. The podcast will also be available, so that if this information is interesting or you want to go back and re-listen, please forward the information to others. We just want our Power Hour to be beneficial to as many people as possible. So at this point, I'm going to turn it over to Sharon for the extension minute, and then I will close this out. Sharon?
Good morning, everyone. Again, it's such awesome information, but before I go to my part with the speakers, with the extension minute, we have Ms. Regina Boykin. She is with Humphreys County. She's the extension agent, and I just wanted her to come and talk about a program in her area. One thing about the extension service, we have agents in each of our 82 counties, as well as the Partnership for a Healthy Mississippi with the Tobacco Free Coalition. So if you need any of our services, please don't hesitate to reach out to us, and I'll share our email address after Ms. Regina Boykin speaks from Humphreys County. And Regina, you would need to *6 yourself to unmute yourself, and the time is yours. And unmute your own phone as well, Regina. She just okay. Regina, can you hear me? Well, she must be having some difficulties coming on the call this morning, but I'm going to give you just a little bit of overview of one of the programs that the Extension Service we provide in the communities. We recently, well, they've been doing it for years, but I've just gotten okay to do ServSafe, gotten my certification through the National Restaurant Association. And what we do to anybody, any food service establishment that needs this particular food safety training, please don't hesitate to reach out to the Extension Service again in all of our 82 counties, and someone should be able to plug you into one of the nearby classes. The Yazoo County Extension Service will be offering a session in July. And what this program actually does for food service establishments is educate the providers, educate the restaurant managers as well as the workers about food safety procedures from the beginning to the end, from receiving the food correctly and safely, as well as cooking and preparing the food, making sure that they keep the food at the correct temperature. Also, when it's all over the end of the night, making sure that they, if they have leftovers and things of that nature, making sure that they cool them down properly, safely, and quickly so that they will not enter into that temperature danger zone, as well as reheating those products to make sure that they are at a safe temperature. And even with the individuals on the call, the people that we are, the dialysis, individuals on dialysis and things of that nature, and people that have a compromised immune system, you want to make sure that their food is served safe, because if not, they are one of those vulnerable populations where it will affect them more. We even have food safety classes for just the regular individuals that are not in the restaurant service, because we don't realize when bacteria is in the food how it can damage as well as kill an individual. And that vulnerable population of people with immune systems that are not just healthy, young people, elderly people. And so again, you want to make sure that you serve that food properly. If you are interested in any type of food safety class, please don't hesitate to reach out to your county extension office. You can reach you can also look on our website at MSU Cares to find out information, because you can't keep food forever in the refrigerator. You can't keep certain foods for certain lengths of time. So it's a great resource on our website to let you know that, because again, if you are caring for somebody or even just yourself, you want to make sure that you are serving your food safe, especially for those individuals that have a compromised immune system, and as well as making sure that you are visiting establishments that have the logo of ServSafe. Is a nationally recognized program under the National Restaurant Association. And when you walk into your restaurants, you will see a certificate. You will know that those individuals that have gone through that training are educated about the proper way that they should handle food from the beginning to the end of the process. So if you are interested in that class, you can reach again any of your extension agents, Mississippi State University Extension Services in any of your 82 counties. If you need any information, I'm going to plug my Mississippi Tobacco-Free Coalition, because I was once one of those project directors and I loved it. But if you need additional information about the dangers of using tobacco products, the dangers of secondhand smoke, please don't hesitate to reach out to one of the awesome project directors in the area. If you need those programs for your organizations, again, you can reach out to some of the project areas in whatever area you're in. This has been a wonderful, wonderful call. I learned so much information that I was unaware of, and I do need to become a donor, because I am did not cross my mind. I just hadn't done it. And what I realized, and what I'm so grateful about, Sandra, is you talked about with the calls. These calls provide so much information that we don't think about on a regular basis. So I hope that everyone that's on the call, please share this information with your loved ones. Make sure that if you are an organ donor, that you make sure that your family members know as they share it with us in their presentation. But what is so startling is just the number of people that are waiting for different, especially kidneys. The facts that you shared, Dr. Shafi, are alarming. There's so many people are having kidney issues, and it's just really startling. And it just makes me even more aware to make sure that I take care of my body, that I need to eat right, that I need to exercise, that I need to make sure that I'm in a healthy weight, because I do not want to have to go through, a situation of or needing a kidney. And we don't realize the things that we put in our body, how detrimental it can be, even though it's good tasting to us. Is it always healthy to us? So we need to, again, to make sure that we are taking care of this body that we have, because, again, it's not promised. And so we, again, Dr. Belinda Lane, thank you so much for just reaching out and asking, to come on the program to share such wonderful, wonderful information. If you are not a donor, please consider. One donor, as she said, can save up to 8 lives. So I think that was absolutely wonderful when you said that. And Chuck, thank you so much for the information that you shared, as well as your own personal story of how important it is to make sure that we are donors, because we could help save someone's life. And Dr. Shafi, just bringing all the information about the kidney donation and the programs that you are offering for the community. We thank you. We applaud you. We hope that you continue to keep up the good work that you are doing in the community. Again, I'm going to ask, before we close out,
I have one question. I
was about to ask one more question. Okay, go ahead.
I have one question before Ms. Shelton come back on. And of course, the organ donor is definitely great information.
Yeah.
I guess, how can we do a better job? And of course, I would be in that group too, of just kind of informing and educating our African American more to become a donor. I know maybe more research needs to be out there. Where can they go? Because I lost a first cousin, stayed on the list for a very long time because he could not find a kidney. When he finally did, of course, it was very brief because of some other things. But I think if we started to donate, know the procedure, we may be more willing to become a donor. And I know now putting that information on your license, you can already have that done. But I'm just not sure if there is enough information, or people don't know exactly where to go in terms of doing that to become a donor, and make sure that's something that we really start to do, is become a donor. But when our loved ones or anyone need a kidney, we have some available for anyone. And I would like to send a shout out. I hate that Ms. Regina Borkin could not come on, because she is a coalition member for LaFleur, Humphreys, and Carroll County. And she's been so helpful in terms of when I host my meetings, they allow me to come into the center and host my meeting there in person. So I would like to say thank you to her.
Belinda, can you go ahead?
This is Belinda. I'd like to share with you that we are always out in the communities. As I said earlier, we travel the state sharing our information. We do that in schools, we do it in churches, we do it via Zoom. And as I told people, I'll even share at your family reunions. As Chuck stated, we need to make sure that we have this conversation. And so having these kind of conversations is not always easy, and it's not always the kind of information that people are just tearing the doors down trying to get, because we don't like to talk about illnesses. We don't like to talk about death. And so as far as the African American communities are concerned, a lot of times we believe in the myths that are out there. And so we much rather listen to that as opposed to listening to the educational portions of the information. But if you have a platform that you'd like to see us appear on, give me a call. You can call me. Let me give my number out. Anyone, because I've had calls from these Power Hour sessions before to come and present, and so I'm always available. We are always available. Mora is. So let me just share my number with you. My number is 601-955-4548.
and we will be more than happy to come. And again, I say, we share this information in your church groups. We share them in your health groups. Any kind of program or platform that you have in terms of health or educational health that's going on, we are more than happy to come and try and make sure that that we get the word out. But here recently, are you in Humphreys County, to the young lady that was just asking the question? Are you in Humphreys County? Erlene, maybe she's.
I think
yes,
she is.
You hear me?
She is.
Oh, yeah.
Yeah, she is.
I am in Carroll County.
You're in Carroll County? Okay. Well, we're more than happy to come and again share any of the information that we need to in your area. So if you have something going on and you think that this is a good fit, we'll definitely come. Or even, like I said, at your church, we can start there. But we're doing everything in our power to get the word out and to let people know that registration is free of charge. There's no cost. And we're trying to do everything we can to debunk the myths and get folks registered to become organ, eye, and tissue donors.
Thank you. Thank you so very much. And I will reach out to you after this conference call. I did come on a little late, so I missed part of it. You are correct. The myth. You are exactly correct.
Well, thank everyone. Oh, go ahead.
Any additional? Go ahead.
I just want to real quick to reiterate again, the conversation is almost equally as important as the registration, and the education to have that conversation is another key component, because unfortunately people aren't educated about donation across the board, especially in Mississippi, and we've got to get the word out there. And a lot of that is just people haven't had access and they don't know about donation. You don't know about something to know about it. And I didn't know anything about stem cell transplants until I had to go through one last year, and didn't think about it. And most people don't think about organ donation until their family is affected by it. But everybody's family, and you heard the doctor speaking earlier, Mississippians are prone to face kidney disease, and that's the most transplanted organ in the country.
Well, thank everyone so much. Let's take 1 minute. We've got just a couple of minutes left if there are any community announcements. Anyone have a community announcement they'd like to share? Okay. Well, y'all enjoy the rest of your day and the rest of your week. Hello?
Hello. Hey, this is Greta Winters. How you guys doing?
We're doing great, Greta. Go ahead.
I just want to briefly just stress again that we are still trying to promote people to get vaccinated. The programs are still available at GA Carmichael and other approved clinics around the state in regards to giving the $50 gift card. So you'll need to contact GA Carmichael to get further information regarding that. I'm also working in conjunction to the program. So persons in Yazoo County who actually get the shot, if they will give their name and contact information to GA Carmichael in Yazoo City, then I can come out and discuss everything with you and give you a $25 gift card upon receiving a copy of your shot record. So I still want to promote that and let people know that COVID is still here, and we do need to stress that you get vaccinated. Thank you.
Thank you so much. We appreciate that, and you're absolutely right. All right, everyone. Well, enjoy the rest of your day, the rest of your week, and we will be back together on May the 24th. Thank you, everyone.